I think I should just take it away. Maybe I should just say a very distinguished surgeon, academic, peer in the House of Lords. I think that's since 2010, and an ambassador also, a UK business ambassador. So I think we're really quite lucky to have him. I'm very interested to hear what he has to say.
Very kind, thank you. Well, Mr. Chairman, ladies and gentlemen, thank you very much indeed. It's a great privilege to be here, and I'm going to talk for a few minutes. When I was invited to talk, I was going to do it from a purely personal perspective as Professor of Surgery at University College in London and an active biomedical researcher. The research institute that I'm director of here in London, the Thrombosis Research Institute, has a sister research institute in Bangalore in India, and that's given me, I think, quite an interesting perspective on what's happening with regard to healthcare and life sciences in India and the huge potential opportunities that exist as a result. But I also, in the last couple of months, have become the UK business ambassador for healthcare and life sciences, and that's given me yet a further perspective. And I know you heard this morning from Ken Clark. He was able to, I think, put in perspective the United Kingdom view about the opportunities for trade and development, or development of trade and other business opportunities with India. And one of the important areas that have been targeted is to have an emphasis on healthcare. And I was lucky enough to open Healthcare UK's activities in India, in Chennai, in early September. And when I was there, I was able to focus on, I think, 4 interesting areas that struck me whilst I was able to lead a delegation of British companies that were looking at the opportunities in the healthcare and life sciences area in India. And they're very much to try and understand what the challenges are for the healthcare system in India, reflect upon the very long-standing relationships and collaborative activities that have taken place between healthcare professionals in India and the United Kingdom for over 6 decades. Look at some of the examples of how British companies, universities, charities are now working in India to drive forward an imaginative healthcare and life sciences agenda of benefit to both countries. And also look at some of the remarkable things that Indian institutions, hospitals, and companies are doing that we can learn from in the United Kingdom, and indeed the opportunities that can be taken forward more broadly in the world. As an example, some would say, of reverse innovation in terms of the United Kingdom considering itself as having a maturer healthcare system. Now, in terms of the challenges, I think it's often forgotten in healthcare that although one sees remarkable hospitals and specialist institutions in India, that there is a huge need for more healthcare professionals, be it doctors, nurses, hospital beds, midwives. And when one looks at the lack of capacity to meet healthcare needs for the country, simple statistics are really quite striking. India produces about 40,000 medical graduates a year, a huge number. But it probably needs to produce about 100,000 a year over the next 10 years to meet the needs of its growing and increasingly demanding population. In terms of hospital beds, it has to create 600,000 more hospital beds to meet its target, I think, of 500 beds per million population. I mean, that's a huge additional demand in physical infrastructure to meet what it considers to be the basic healthcare needs of its population. And so too, there are similar statistics in terms of the numbers of nurses, midwives, and strikingly, the development of a complete infrastructure for the delivery of primary care, which doesn't exist at the moment in the country because the way that medical education and postgraduate training is organized is on a system that looks very much like the system that we had in the United Kingdom 60 or 70 years ago. But there are other challenges in terms of assuring quality, not in the most excellent centres that exist, the super specialist hospitals in some of the great metropolitan cities in India, but quality across an entire healthcare system, a governance structure that assures quality and gives confidence to the individual patient, the individual citizen, and their families. And of course, there are structures in place, but many of those structures need revision going forwards. And just as we have had to do with our own regulatory systems in the United Kingdom, a complete revision, for instance, of the General Medical Council over the last 15 years, to focus its purpose on protecting the public and serving patients, so too, not only in India but throughout the world, developing healthcare systems need to understand how what we have learnt and others have learnt might be adopted without the same pain that we suffered for their healthcare systems, which are invariably much more complicated and have to serve many, many more people. But I think what struck me when I was in India in September was how strong the relationships are in healthcare between India and the United Kingdom. And they're built upon the fact that 65 years ago, when the National Health Service was being established in the United Kingdom, it called upon and has subsequently depended upon very large numbers of doctors and other healthcare professionals of Indian origin to ensure that a strong and sustainable service could be delivered. And those links are strong. About 19% of the General Medical Register in the United Kingdom declares itself as of Asian or British Asian origin. That is a vast contribution of a single community to the delivery of healthcare in the United Kingdom. And those strong, established contributions in the United Kingdom are attended by equally strong, ongoing and sustainable links at a personal, professional and institution level between doctors of Indian origin in the United Kingdom, of which the British Association of Physicians of Indian origin now suspect there are some 40,000, with their counterparts, family members, colleagues, medical school co-graduates in India. And I think that represents a unique opportunity at a very personal level for the two countries to work very effectively together in the areas of healthcare and life sciences. And we're starting to see, I think, very important manifestations of that natural affinity, built upon the fact that the systems of medical education have traditionally been very similar, that undergraduate medical education is taught in the English language based upon curricula that have somewhat changed now in the UK, but were the traditional approach to education in this country. Built upon the fact that the regulatory system, the Medical Council of India, very much reflects the old General Medical Council and the way that regulation was done in the United Kingdom, and that the approach to postgraduate training, both in India itself and indeed the important emphasis that has always been put on Indian doctors going abroad to achieve part of their postgraduate training, and frequently, for many of those doctors, training in the United Kingdom, thereafter returning to India to become leaders of the profession there, provide natural links on which both opportunities for trade in healthcare, but the development of institutions, the provision of education and training, the development of quality assurance and regulatory frameworks sit very comfortably, because there is a natural affinity and understanding between the two communities of healthcare professionals. So I think that when we look at the question of healthcare and life sciences from a UK-India perspective, what I see are a large number of opportunities, clearly important challenges defined not only by the scope of the issues facing healthcare systems in India, issues around ensuring an equity of access, a very, very important problem for such a large democracy, but also issues around ensuring that the vast investments that need to be made to deliver sustainable, quality healthcare systems can be made on an ongoing basis, but also challenges that we face in our own more mature healthcare system here in the United Kingdom, where we see basically a system tackling problems of aging populations, with multiple comorbidities, much more chronic disease, and therefore the need to understand how we can better adapt our own systems to become more efficient, more effective in the care they deliver, and more able to deliver care in a way that's going to be sustainable for our own population. And the two systems have a huge amount to learn from each other. The question is, how do we go about achieving that collaborative learning? How do we go about bringing together groups of healthcare professionals, institutions, regulators, commercial enterprises to work effectively for the benefit of both healthcare systems? And here I think the approach that the UK government has taken through the establishment of Healthcare UK, an entity, an agency built across the Department of Health and UK Trade and Investment to help facilitate and foster those relationships, is one potential very positive example. And if there can be appropriate engagement using the good offices of Healthcare UK and its equivalent counterparts in the Indian government, then I think there can be an accelerated approach towards building and promoting those links, built upon a natural understanding and affinity between the two communities, which I'm sure can deliver the greatest benefit for large numbers of both the Indian and UK populations. Thank you very much indeed.